All right, that's our fun stuff for tonight. It looks like we've got a decent amount of people on, so let's go ahead and get started. I'm going to introduce Dr. Carly Richards. She is board certified by ABFAS and the American Board of Wound Management. She's 20 years of experience in medical and surgical podiatry and wound care. She's traveled internationally to educate athletes, coaches, physiotherapists, and colleagues on injury prevention. She's the principal investigator of Protect Our Players, which is a research initiative focused on identifying lower extremity injury risk factors in female soccer players. In addition to her clinical and research work, she contributes medical content to the U.S. Soccer's Recognized to Recover program and provides educational resources on injury prevention for athletes, coaches, and medical professionals. As the USA Ambassador for Spirit of Football EV, she advocates for social inclusion and global connection through soccer, merging her medical expertise with cultural exchange and community engagement. She practiced mostly in Pennsylvania, but recently moved to Chapin, South Carolina, which is near Columbia. And fun fact, Dr. Richards and I live in the same town. So that's pretty exciting. And it was just kismet, just super small world. All right. So, Dr. Richards, do you want to go ahead and share your screen and we'll get this party started?
Okay, thank you everyone for coming. I appreciate it, especially after a long day of work in the office or 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 wherever you're coming from. I'm going to be speaking on reducing lower extremity injuries in both youth athletes, primarily soccer players, and female athletes. This is just a little bit about myself, which Anne already covered, so I don't need to go into any of that. I've been in podiatric orthopedic practice for over 17 years and spent most of my time treating athletes, both with injury prevention and after they've been injured. So as far as disclosures go, this is sponsored by PowerStep, and that is why we have Jay Kane on. So thank you, Jay, for sponsoring this lecture. So to get started, I'm going to speak on youth athletes first. And then we're going to switch gears to female athletes, which is a passion of mine, and I've been doing a lot of research on over the last probably about 15 years of my practice. So with the youth athletes, we're going to look at open growth plates, overtraining and early sports specialization, and also rapid growth during strength and flexibility and balance while they're playing sports such as soccer. Female athletes, we're going to look at hormonal changes and why that increases their injury risk when compared to their male counterparts, how our biomechanics are different, cleat and footwear design for male-specific foot versus female, and then strength and conditioning considerations. So the top 5 lower extremity injuries in our youth soccer player, number 1 is ankle sprains, which we all see routinely in the office. This represents about 39% of all lower extremity injuries in youth athletes. And it's usually caused by an inversion injury due to an uneven field, poor shoe gear or from the cleat getting stuck in the field, or a poor landing mechanism from the athlete. Knee injuries are number 2. That's about 29% of the youth athlete injury population. And this is usually from a plant and churn injury from cleats getting stuck in the field, and also can be from contact injury. Number 3 are shin splints. This is about 2 to 25 prevalence. And this is mainly from overuse, overtraining, sports specialization, and poor footgear or footwear. Calcaneopathitis, which we all know as Sever's disease, that's actually the most common thing I see in my practice. This is about 8% of all overuse injuries, and it's usually due to overuse, kids playing year-round, poor field conditions, and poor shoe gear. And then number 5 are muscle strains, which is usually due to inadequate warm-up, inadequate stretching, and occurs during explosive movements or during sprints down the field. So those are our top 5 injuries in the youth population. Some key stats with our youth soccer: 50% of all youth sports injuries are due to overuse. That's across the board: soccer, football, lacrosse, field hockey. 50% are from the kids playing too much, not taking breaks, inadequate rest. 22% of soccer injuries are from overuse. Sever's disease occurs in up to 11% of youth soccer players annually, and the highest risk is during the growth spurts, usually ages 8 to 14 is when we see Sever's disease. So a quick slide about Sever's disease. Causes overuse. It can be caused by repetitive microtrauma from pull of the Achilles tendon or plantar fascia on the apophysis. Pain is worse with increased activity. So it's not pain at rest, it's pain with play. And on clinical exam, it's pain with lateral compression of the calcaneus. Now, when this patient comes to your office, you always want to get an x-ray because pain with lateral compression of the calcaneus could also be a stress fracture. So of course you want to rule that out. X-rays with Sever's disease can be normal, so it is more of a clinical diagnosis, but in a significant case, you can see fragmentation of the apophysis as well as sclerosis, which is what we see on this X-ray. So that is a radiological sign of Sever's disease. Treatment, it's the big R word, R-E-S-T, and that is what both players and parents don't like to hear. But as physicians, it's important to push that so that the athlete can get back to his or her sport as quickly as possible. NSAIDs help, ibuprofen, kids ibuprofen before a match or at the end of the day, after they're done playing. Stretching and physical therapy are good to help stretch out that Achilles tendon, especially if there's an equinus component. Shoe modifications. I always put my athletes in a heel lift in their cleat when they come in with calcaneal apophysitis. That helps to decrease stress. It takes the stress off of the apophysis by lifting that Achilles tendon up. And then in a severe case, I immobilize the athlete in a cam boot for a few weeks, 2 to 4 weeks, depending on the severity of the pain. And it's all related to pain. So I treat each athlete differently. I have some kids who have this where they play through it, and some kids who it's very severe and we have to put them in a boot and rest for 2 weeks to a month. So why are soccer players at high risk? What I already talked about, early specialization and year-round play. This is an American problem. It's getting worse. Every youth club is year-round. I have 3 kids who play when they get a month off in the summer, which is ridiculous. And, it's they're done in July and start at the end of August again. So that is a big problem with these youth sport. High running loads, cutting and pivoting can increase injury risk, growth plate vulnerability. So that's, again, the Sever's disease, inflammation of the apophysis, especially during growth spurts. And then poor footwear and mismatch with playing surface, which is what I'm going to focus on today. So I do a lot of education for players and coaches about shoe gear, cleat length, and playing surface. Those are the 3 things that can increase injury risk when the education's not there. And I found that in the youth population, most players and most parents don't know what type of cleat or stud length their player should be in when they're playing their sport. So that's what brings me to shoe and cleat consideration. 80% of youth soccer players wear men's cleats. So they go to the store and they're pretty much buying the men's version of whatever cleat. And this results in a poor fit with the pressure points being different and just not adequate for the youth foot. This is especially true with women, which we'll get to later. Another issue with cleats is the wrong length stud with the playing surface. So if the athlete is on firm ground and they have a short stud, they could slide too much, versus if they're on artificial grass and they have a long stud, the foot can actually get stuck in the turf and cause that plant and turn injury, which we see often. That's the knee injury and the ankle injury, which we'll talk about shortly. Lack of cushioning contributes to heel pain and stress injuries. Lack of arch support can lead to shin splints and medial leg and knee injuries. And unfortunately for our athletes, most cleats don't have arch supports and have 0 to very minimal heel cushioning. So this also can increase the risk for those injuries. So solutions for this is to try and encourage youth-specific cleats and proper fit. Can add a heel lift or a heel cushion in the cleat for the kids that have the heel pain and Sever's disease. And then, of course, orthotics to correct overpronation and to offload those high-pressure areas, whether it be at the sesamoid apparatus or in the medial arch or heel. So those are all important educational points for our youth population. This is a great orthotic that I like for our athletes. This is Curex, and it's from PowerStep. The nice thing about this orthotic is it fits in cleats. So most orthotics don't fit in cleats because, you know, with soccer players especially, they want that tight fitting cleat so that they can have a good touch on the ball, good turning and cutting movement on the field. But with that tight cleat, you can't really get much modification, and you definitely can't get a custom orthotic in there. So the Curex Cleat Pro fits in an orthotic. It's not rigid, but it does give the athlete enough arch support to help correct some of the pronation, take some pressure off of the medial leg and medial knee. Another pearl that I use is a scaphoid pad. So if you just take a scaphoid pad from your office, you can put it in the medial arch of the cleat, and that helps to offload that medial column and give a little bit of an arch support. It's better than nothing, especially if the athlete doesn't want to change the fit of the cleat. And then, as we already talked about, heel lifts for any heel pain. And a really cool cleat on the market right now is called IDA. It's IDA, and they're specifically for women and female youth soccer players. And these cleats are made off of a female last, specifically for the female anatomy. So they have a wider toe box. They actually have a cushioned heel, and they have an arch support incorporated into the cleat. So these are really great for youth female athletes and adult female soccer players, which we'll get to in a little bit. Field conditions is a big educational point for my athletes as well. It really makes a difference as to what cleat you're wearing on the playing surface that you're on. In America, and not so much in Europe, but in America, our kids rotate from one playing surface to another. So they'll practice on turf, compete on grass. The next day they'll be indoor and they'll be on court, and then back on grass and then back on turf. And unfortunately for our athletes, most of them are wearing the same shoe no matter what field they're on. So with that, the cleat length doesn't change, and that can really increase the risk for lower extremity injury. So it's very important to try and encourage our soccer clubs and our coaches to have the kids train and compete on the same surface, whether it be artificial grass or firm ground, real grass. And also for the coaches to make sure that the stud length on the cleat is the appropriate length for the playing surface. A lot of parents and players don't know about this, and when you go to a shoe store or to Dick's Sporting Goods and buy a pair of cleats, there's nothing on the box that tells you what cleat length you should be buying for a certain playing surface. It's all in initials. It's MG, AG, FG, and they just expect you to know what that means. And most people do not, especially at the youth level. So this is a very cool slide. It's from soccer.com. I use this a lot with my athletes, and it's educational. I just say, go to soccer.com, go to the cleat guide. And it's a nice chart. It's a layout as to what length stud should be used for the appropriate playing surface. So you can see the artificial turf shoe is here. It's a short rubber stud, and artificial turf is indoor. So that's indoor turf. And you want a short rubber stud for that. You don't want anything long on artificial turf. If you have a long cleat on artificial turf, that cleat's going to get stuck in the turf, and the foot will not move when the leg moves. So that foot will get stuck in, and that is how we get those lower extremity injuries like the knee and the ankle injuries. Artificial grass cleat is in the middle, and the artificial grass is the outdoor artificial grass. So it's a little bit longer, it's a little bit more plush, but it's still not real grass. So the same thing with this surface, you don't want a bladed stud. You need a multi-ground, or what they say FGAG stud, which is firm ground / artificial grass stud. And that's a mixture of different stud lengths on the bottom of the shoe. So most of them are conical and round, so that when the player plants their foot, the foot will actually slide with the leg, so that the foot doesn't get stuck in and cause the lower extremity injury. And then finally, when you have the third little box here is your firm ground cleat length, and that's grass. That's real grass, hard ground. And with those, you can have a longer, more bladed stud so that the player can get a better grip on the ground. But even with that, the longer the stud you have on the shoe, the higher the chance of injury with play. So this slide, I think, is very, very helpful with education for youth athletes. And again, it's from soccer.com, and I do recommend that website to my patients often when they're asking about stud length. So as we noted earlier, the most common lower extremity injury in soccer is our common ankle sprain, which we all treat on a daily basis. It's usually the inversion ankle sprain with the foot plantar flexed and turning inward, which causes lateral ankle injury, whether it be ATFL, CFL, tear, or high-grade sprain. And causes of this can be multifactorial. One is poor playing surface. They step in a hole, they come down wrong. It could be from a poor stud length on their cleat, depending on what surface they're on. It can be from an awkward landing or poor proprioception. Any of those things can cause this injury. And as far as treatment for this, I'm not really here to talk about treatment. This is more of an educational and prevention lecture, but it depends on the type of injury. So obviously, if it's just a low-grade sprain, you might put them in an ankle brace, get them to PT, maybe do some taping, get them back to play pretty quickly. Obviously, if there's a high-grade tear, they're going to be off for a while. They may need surgery for lateral ankle reconstruction. So there's different variety of treatments depending on the grade of injury with this. But this is by far the most common lower extremity injury in the youth population. So once the player is returning to sport after their ankle injury, oftentimes they want some extra support for stability. A lot of times just a good tape job works because they have to be able to get whatever brace they have in their cleat. And this is where that problem with soccer cleats comes back into play. It's hard to get a big ASO ankle stabilizer in a soccer cleat. This dynamic ankle support sock by Power Step is pretty cool because it's low profile. So although it's not as rigid and supportive as your ASO, it's still more supportive than strapping or taping, and actually will fit into your soccer cleat. So this is a good product that I like to recommend to my athletes when they're getting back to play after their ankle sprain or a ligament injury. So check that out. It's a good, reintroduction to play product that they can maybe play in for the first week or so. And then once they're feeling strong enough, just get back to their regular cleats without any support. So prevention strategies for youth athletes. Try and avoid specialization. I know that's hard, but really as a physician, we should encourage multi-sport participation to avoid repetitive injury. When players and patients play different sports, they're using different muscles, they're using different body parts, and their injury risk goes down. Strength and neuromuscular training is really important. The FIFA 11 Plus program is a really good program that US Soccer uses and FIFA to help prevent injury. They start at an early age, I think 10 or 11 is when they start, and it goes all the way up through the pros. This program should be done 3 to 4 times a week throughout the season, not just in preseason. So I try and really tell players and parents that the players should be doing this throughout to help prevent injury. Proper footwear and cleat modifications. So the Curex Cleat Pro, like we talked about from Power Step, scaphoid pads in the shoe to give a little bit of an arch support without compromising the cleat feel, heel lifts as needed for calcaneal apophysitis, and then ankle support after an ankle injury or even to prevent ankle sprains. There are studies out that show that taping the ankle or a low profile ankle brace will help decrease the risk of that lateral ankle sprain. And then, of course, monitor growth and adjust loads during growth spurts. So when that patient is having heel pain or knee pain from apophysitis, it's good to decrease their workload and encourage rest. And then obviously the last point is schedule rest and recovery. And as physicians, I know we're usually treating injuries or doing surgery, but this education is key. I have a lot of parents that come to see me now just for shoe recommendations or ask, how can my son prevent his heel pain from coming back? And so it's really good to be able to go over these different things with parents to help prevent the injury and prevent the pain, and then instead of we're just treating it all the time. So that is my information about youth soccer. Now I'm going to go on to a little bit of the FIFA 11 Plus program, which focuses both on youth, adults, and female soccer players. And I know I just touched on this, but this is very important for injury prevention, especially in the female soccer population with the increased injury risk for ACL tears, MCL tears, and ankle sprains. This program really focuses on strengthening the quads and the hamstrings, and it focuses on landing techniques, which is important both in youth and in female soccer players. So in our youth population, just teaching them how to land appropriately can help prevent injury. A lot of kids tend to land with their knees extended, and women especially land with their knees extended. So teaching them how to land with the knees bent, without hyperextending their legs on landing starts at an early age. And FIFA is really pushing this right now with youth soccer. So that's an important piece that I push as well with education. So this is the take-home points for youth soccer. Overuse makes up greater than 50%. Shoe fit and surface mismatch are major causes of injury. Gender and age-specific footwear and appropriate surface choices can actually reduce injury risk. And prevention requires awareness, right? So as physicians and parents, because I'm a soccer parent as well, and I'm sure some of you are too, it's important to educate our friends and our kids and their teammates on how they can help mitigate some of these injuries. So now I'm going to move on to the increased risk of injury in the female soccer player. And this is usually what I speak on. I travel a lot and speak to mostly international soccer players and coaches. And over the past probably 3 to 5 years, there's been a big movement, as you can see on TV, towards women's sports, which is awesome, and equal pay, and how we need to change things for our women athletes to support them, both in the gear that they wear and also in the medical side of it and the medical care that we provide them, because we are made differently than the male athletes and the treatment and prevention is different. So some contributing factors that increase injury risk for female soccer players, sorry, this keeps skipping forward, anatomy, neuromuscular, hormones, shoes and playing surfaces, which is very similar to the youth population, directional change, and environmental factors. This is a pretty interesting slide on female versus male injury rate. You can see that ACL injuries are 8 times more prevalent in women soccer players than in men. Concussions are twice as common in women soccer players than in men, and ankle sprains are 5 times more prevalent in women soccer players. This is an interesting study that was published by UEFA. They looked at 1,527 injuries over 4 seasons from elite soccer club. And what they found that one football team, which is a soccer team, should account for 35 injury losses per season, which ACL having the highest burden on the club. So that's 35 injuries for one team in one season in an elite female soccer club. The average time loss per ACL injury is 9 months. So that's a big financial loss for the club, having a player out for 9 months. Having, 15 to 20 players out for 9 months is even a bigger financial loss. And 72% of the 1,527 injuries were actually non-contact in nature, meaning these lower extremity injuries were happening from the way the player was landing, from a plant and turn injury, neuromuscular imbalance, hormone imbalance. So there's so many different factors that are contributing to these injuries and that are non-contact. At the 2023 Women's World Cup, there were 30 athletes from international teams that were unable to participate in the World Cup due to lower extremity injuries. So Mallory Swanson is one of them. That's her on the left. Another one was Leah Williamson, Beth Mead, and then Katie Rood, who's in the middle here. She's from New Zealand. So those are just a handful of these high-level professional players who missed their possibly one World Cup debut due to a lower extremity injury. This year in the Women's Super League, and for those of you who don't know, the Women's Super League is the top league of soccer in Europe. There were 4 ACL tears in the Women's Super League in the first 4 weeks of play. That's 1 ACL tear per week. There have been over 25 ACL injuries during the 2024-2025 season. When they compared that to the Men's Premier League, there were only 11 ACL injuries. So you can see it's significant. It's more than twice the amount of lower extremity injuries in the female athlete population. So the big question that a lot of these international players and organizations are asking is, why is this happening so much more frequently in the female athlete population? And that's kind of where I got involved, is been doing some research to see what part of these factors plays more of a role in the injury risk. So the first thing we look at is anatomy. Obviously, women have a different anatomy than men as far as from the hips down and elsewhere. But one of the biggest things is the Q angle. The Q angle normally is 12 to 20 degrees. Women's Q angle is higher than men's, and that causes increased knee valgus and pronation of the foot, which then leads to internal tibial torsion and pressure on the medial knee. So that is hypothesized to possibly be an increased risk factor for the lower extremity injuries in these female athletes. The femoral notch has also been talked about. That is where the ACL attaches on the femur. The femoral notch is smaller in women than it is in men. So whenever they have either a contact or plant and turn injury, there's a little bit more torque on the ligament attachment, and that has been hypothesized to be a cause of the increased risk of the knee ligament injury. And then lower extremity alignment is also obviously different in women than in men, and this will cause increased pressure on the medial leg, medial foot, and medial knee. So all of these anatomical differences have been hypothesized to possibly be a cause. So that is one level of the puzzle that scientists and medical personnel are looking at, both within US soccer and also on the international FIFA side of things. Neuromuscular is another difference. Gender differences in the hamstrings and the quadriceps can actually increase the risk of these ACL injuries. So men inherently have stronger hamstrings and quadriceps than women, and they're about equal in strength, so they give more knee stabilization. Women are more quadricep dominant, meaning our quads are a little bit stronger than our hamstrings. So when a woman comes down from a jump and lands, the quads fire more than the hamstrings, and that can lead to hyperextension of the knee and increased risk to that ligament injury. So that's another factor for these increased injury risks for the female athletes. And then finally, hormones do play a factor, and that's also being looked at as well. There's increased ligamentous laxity from rising estrogen during certain parts of the menstrual cycle. And there are studies being done to look at different phases of the menstrual cycle to see if that might correlate to the increased lower extremity injury ligament risk to these female players. There was a study done in 2021 that found that there's an 88% higher tendon muscle injury rate in the late follicular phase of the menstrual cycle, which is when estrogen levels are increased, which is when our ligaments are a little bit looser. So there are a few different studies that have been done. Some of them are conflicting. There's no solid evidence with this yet, but that is what we're finding in female sports. There aren't many studies looking at any of these factors yet, so we're trying to do more research so we can make better recommendations to help mitigate these injury risks. And this is a slide that I show to athletes because it's really hard to figure out what phase of the cycle that you're in and where your hormones are at during those different phases. So we do a lot of nutrition education based on different cycle phases, and also just an education on when ligaments might be looser and injury risk might be a little bit higher, just to help during training. And the U.S. Women's National Team, they actually track each one of their players' cycles and base the training regimen off of their menstrual cycle, including nutrition recommendations. So there are a lot of professional clubs going to this to try and improve nutrition and also mitigate the injury risk. So 2 phases where it has been shown that injury risk might be increased during the menstrual cycle are late phase 2, just before ovulation when estrogen levels are elevated, as well as phase 3, which has both elevated progesterone and estrogen levels. And there have been a few studies out that showed that the ACL tear risk is higher during these phases of the menstrual cycle. So that's another educational piece that we use when we're talking to players. So with soccer shoes and the fields, it's the same as for youth athletes. The education has to be there as to what playing surface the athlete is on. They have to make sure they have the right stud length for the playing surface. And you would be surprised at how many pro athletes don't know this. I've done a few conferences in Europe where I just talk about stud length and different playing surfaces. And I've had some athletes come up and say, I just have one pair of shoes and we use it on every surface. And the education's just not there. So it's really important to try and educate players on different stud length for the playing surface, because that can, in my mind, that's one of the biggest risk factors for some of these plant and turn injuries. So as we said before, if the stud is too long and you're on artificial grass, the chance of that stud getting caught in the grass and causing a plant and turn knee or ankle injury is relatively high. As far as soccer shoes, there aren't many shoes. In fact, I only know of one right now on the market that is made specifically for females. The Ida cleat, which I talked about earlier, is made on a female-specific last, whereas all the other soccer cleats on the market, to my knowledge, are only made with a men's last. So that really impacts the female anatomy and what we talked about earlier, how our hips are wider, we turn in more, it increases the pressure on the medial knee and the medial tibia. And when you're walking on a shoe made for a man and you don't have the arch support that's needed or the wider toe box that's needed because the foot's wider, it can really increase the injury rate. So that's something that we're trying to push in the industry. I've worked with some different shoe companies and it's getting there, but it's very slow. And the soccer players are aware of it, and they're also trying to push these shoe companies to make shoes that are specifically for women. And I think we need to do it for the youth too, because the youth players are also wearing men's shoes. So these are some examples of different cleats. Nike's on the bottom, the Ida cleats on top. You can see the Adidas F50s on the right, and these are all marketed as women's cleats. And to my knowledge, only one of these shoes is truly made for female anatomy. So it's interesting, we know when a parent goes to the store and they're buying their girl a woman's cleat, it's not really what they're getting. The marketing is a bit off with that. So as physicians, when they do come in with a cleat that's not fitting right, we can modify it. We can throw that scaphoid pad in. We can add a heel lift. But because of the fit of these shoes, they are hard to modify because of how narrow and tight most of these cleats are. And this is, as podiatrists, we all know that the anatomy of the foot is different and that every foot is different. Not all women have the same foot. Not all men have the same foot. But normally, a women's forefoot's a little bit wider. The arch is usually a little bit higher, and then the heel's a little bit more narrow, which can change the fit of a shoe. So with the IDA cleat, they actually have a wider toe box, and they have an arch support built in. And with their kids' cleat, they have a little bit of a heel lift in it, which is pretty cool. And the studs of the IDA cleat are actually conical, so they don't get stuck in as much. And so that's definitely a shoe to check out. They do sell them in the US now in most stores. But I really try and recommend this shoe for female athletes and youth athletes, youth girls. And this is just a little bit of what we went over with the youth. Scaphoid pads to help improve arch support if needed, Curex Cleat Pro Orthotic that will fit in the cleats, and then the IDA cleat that has the incorporated arch support built in for women. There's also a new Adidas F50 that was just released that is also marketed for women. I don't have enough information on that yet, so I'm not sure if that is made specifically on a female last or not, but I'm hoping to gain more information on that one soon. So a little bit more about the studies that are being done in Europe on injury rate with women. There's a study done from 2021 to 23, which evaluated 4 top-tier European women's teams, and they looked at both injured and non-injured players. The study showed that injured players had a higher frequency of less than 5 days between matches and had less rest time than the non-injured players. So there's studies going on about overuse in women athletes as well, which I think is relevant to the kid athletes that we deal with here. Without rest, the injury rate goes up. FIF Pro is a pretty cool website that you can send athletes to where they can actually monitor their workload. So that website at the bottom here, if you click on it, it will take you to FIF Pro, and then an athlete can sign up and they can monitor their workload where they log in how many practices they're doing, how many games they're playing, where their games are. If they're a high-level athlete, professional, or on a national team, they can track travel time and also recommend how much rest is required between matches and travel. So that's something that they're doing through FIF Pro. So with all of this, and in going to a lot of these international medical and soccer conferences, I realized that not much research has been done. So I decided to do my own study, which I launched in 2024, to kind of look at all those factors that I talked about with the female soccer players. So I launched 2 online HIPAA-compliant surveys in October and November of 2024. The first one was launched at the Athens Women's Football Summit, which surveyed mostly professional soccer players and teams. And the second one was surveyed high-level club teams in the US. The ages of the participants were 14 to 40 years old, and the levels of play were club, high school, collegiate, and professional. The first survey looked at, only had 12 questions and only surveyed injured players. And the second pilot survey had 21 questions and surveyed both injured and non-injured players. So some interesting results from the injured players of survey 1 and 2. There was about 71% injury prevalence. That means 71% of the players who took the survey had suffered a lower extremity injury at some point in their career. Most common injuries were ACL tears and ankle sprains. And that's kind of what we've been talking about. Those are the highest reported injury in these soccer players. 59% of the injuries were on firm ground. and 80% of the injuries of women's soccer players were wearing men's soccer cleats. About 50% participated in strength and conditioning prior to their injury, and about 70% were unaware of their menstrual cycle phase during their injury. Of all those injured, about 51% required surgery and 11% had career-ending injuries. With the non-injured players, 70% of those who were not injured reported wearing women's soccer cleats. 65% of non-injured players played on artificial turf. 65 did strength and conditioning programs, and about 60% of non-injured players actually tracked their menstrual cycle, which was very interesting. So those are some interesting stats after this survey that we conducted. So data analysis, about 3.5, there was a 3.5 increased risk of injury with men's cleats. Strength and conditioning actually lowered injury risk by 50%, and menstrual tracking lowered injury risk by 50%. So that chart that you see, the red represents the injured and the blue represents non-injured. The first parts is those that were wearing men's cleats. You can see the red, much higher injury rate in men's cleats. Participates in strength and conditioning. You can see the much higher, with the non-injured, the rate was much higher of those who participated in strength and conditioning. And then same with the menstrual cycle tracking. So the survey really gave the results that we were suspecting, but it didn't help to narrow it down as to what might be more of a causative factor with these female athletes and their injury rates, because the population was pretty low. We only had a little bit over 200 participants in the survey. So with the survey, what we learned that shoes matter. Men's boots on female athletes can increase injury risk. Strength and conditioning will decrease injury risk. Menstrual cycle awareness and just tracking of the cycle can lower the risk of injury. And then consistent surfaces and playing fields actually lower injury risk as well. So at the end of the day, it's really, prevention is key. We want to educate our female athletes on strength and conditioning, female-specific nutrition programs, soccer shoes made for female anatomy, educational menstrual cycle with training and nutrition guidelines, and consistent training surfaces, and of course, rest and recovery in between matches. So despite all of this, the topic is huge internationally with both soccer and basketball community, because the lower extremity injury rate is so high in these female athletes, and the research is not quite there. My friend Kat Krieger from FIFA did a study in 2022 that determined that only 497 peer-reviewed studies have ever been done on female soccer players. So there's just not enough evidence out there to make appropriate medical recommendations to help mitigate these injury risks. Michelle Kang is an entrepreneur from the DC area. She owns the Washington Spirit, and she is one of the biggest financial investors in women's soccer. She has started an innovation and research lab for injury prevention with the Washington Spirit, which is excellent. So things are being done. She's looking at biomechanics, neuromuscular differences, and hormone tracking. And then also FIFPro and Nike is also doing a study. They're reviewing existing research on ACL injuries in female soccer players to assess professional teams, and also provide real-time tracking for workload and travel via FIFPro. And that's that website I showed you earlier, where players can track their workload. So this is a protocol that I developed that I hand out to my players, my athletes. It goes through all the kind of points that I talked about today: strength and conditioning with FIFA 11 plus program listed, cleat and stud length for playing surfaces, shoe selection for female anatomy, consistent playing surfaces and how that's important, hormone education for women, and proper time off. And there are different websites with education links to all of those areas that is helpful for the athletes. Another good source is US Soccer, Recognized to Recover. Their website has information on every injury you can think of. They have a concussion, They have knee, there's foot and ankle. So that's a very good educational resource for your players. It talks about how an injury happens and then what the recovery looks like and what they can do to help prevent that recovery. So I did the foot and ankle portion of this, but the whole website is good for education. And then finally, as I said earlier, we need more data to protect our players. And it would be great, anyone out there in the podiatric medical community, if you're interested in helping with research study, I have a bigger survey out there. We're trying to get over 1,000 players to take to really narrow this research and data down and try and figure out what the most causative factor is for the lower extremity injuries in female soccer players and what we can do as medical professionals to help mitigate that. So this is the new survey that I have out. I hope to get it out with U.S. soccer teams within the next few months. It's already being distributed amongst a bunch of professional teams, both in the U.S. and Europe. If you're interested in giving this out to players, it's for women or female athletes 14 and older who play club, high school, collegiate, or professional soccer. It's HIPAA compliant. It's completely anonymous. I'm not collecting any personal data. And it's a really quick 10-minute survey for the player or the player and their parents to take. So that's the link. And my email address is below it. If you have any questions, I'd be happy to chat, and would love to get some more help with this so we can get more information on lower extremity injuries with female athletes. And that's pretty much all I have. I really appreciate everyone's time. I'm sorry that was a little bit long, but it was a lot of information. So thank you.
That was awesome. I love it when, I almost said I love it when a plan comes together because that's just what rolls off my tongue. But I love it when someone is as passionate as you are about a very specific topic. So I think that's great. We do have some questions here in the Q&A box. So I'm going to start at the top. This one says ankle sprains versus Salter-Harris injuries, question mark.
What's the question? I mean, yes, we see them all.
That came in at the very beginning of the presentation.
Okay.
So did you have a slide at the beginning?
Yeah, it was just about the high-grade ankle sprain. Let me see if I can find it.
Cool.
Yeah, so I see both ankle sprains and Salter-Harris injuries with the youth athlete. And depending on the clinical exam and the x-rays and the mechanism of injury, helps to determine what it is. As far as recovery, again, it depends on the degree of the injury. If it's I'm not sure what the question is.
Yeah, that's okay.
Yeah.
Could you please elaborate more about the difference between youth cleat versus men's cleat?
Sure. So with the shoe industry right now, it's not very clear as to whether or not they're actually making cleats for youth and female athletes. I am 100% certain that they are not making them. I'm sorry, can you hear me? Yeah, sorry, I thought it was me. I know they're not making them for female athletes because I've had conversations with some of the top companies and they're male-based cleats. With the youth, I'm relatively certain it's the same, where they're taking a male adult last and just shrinking it for the youth. So what I'm saying is, I think, as podiatrists, and I know this is tough, especially with these big companies, but really encourage them to focus. I mean, the youth sports is huge in the United States. Some of these companies should be making them specifically for youth athletes and not just, a male last and then shrinking the shoe. So that's my opinion on it. Whether that's correct or not, I mean, it's up for debate, but I think it is important to have specific lasts for different foot types.
Let's see here. For professional athletes, is there any info on the rate of ACL injuries for women on birth control versus those not on birth control? It would seem that those on birth control would have the advantage of having lower estrogen and progesterone.
That's a great question, and there's been one study out on it. So no, the information is not there, and that is where we are lacking with all of this data. So in my survey that I have now, that's out, that's a question, is are you on birth, like when you sustained your lower extremity injury, were you taking oral contraceptives? So that's actually a question, part of my survey, to help to get some of that data.
What does menstrual tracking do to limit injuries?
So it just makes players more aware of where they're at. So, and when we educate, we don't tell them to change their habits too much as far as playing. Like if someone's in their late follicular phase and their estrogen's high, we're not going to tell them not to play. So it's just more about be aware of where you're at. And you can actually, there's nutrition guidelines around it. So there are collagen-rich foods that are recommended during the late follicular phase when estrogen's increased. Each of these high-profile teams have a nutritionist that actually base the athletes' meal plans around their menstrual cycle. And it helps to aid in recovery and also injury prevention.
What's a good article regarding nutrition and menstrual cycle?
I would have to look that up. I don't have that off the top of my head, but I can find that for you. Yeah.
Do you have a list of recommended athletic shoes for other sports?
I focus primarily on soccer. I know that a lot of them cross over, like the Ida cleat can be used for field hockey and lacrosse. I like Adidas and Puma a little bit better because they're a little bit wider in the toe box. So I have two girls and a boy, and they all play soccer, and my girls wear Ida and Puma cleats. They seems like there's a little bit more support, and the toe box is wider.
Do you dispense the PowerStep Curex Cleat Pro from your office? If so, what do you charge? Amazon sells them for $60.
So I'm gonna kick that one over to Jay. I don't know if Jay's still on.
Here I am.
He's here.
Yeah.
We do not have a lot of podiatrists that carry it in the office. Most are recommending to a local run store, actually, because that's gaining popularity even within the those independent running stores. But obviously, a podiatrist can buy it, and it would be the same profit margin that a Power Step would be. So you'd be looking at a $25, $30 product, and you'd be selling it for $55 to $60.
So that's pretty comparable if they can find it on Amazon to whatever Amazon's selling it for.
Yep.
At what age do you suggest starting a strength training program?
10 to 11. So that's...
Wow, my kids are way behind the ball.
When you say strength, I don't mean in the gym lifting weights. I mean the FIFA 11 plus. So it's more plyometrics and squats and different activities to teach them how to land correctly on the field, and also strengthening the quads and the hamstrings. It's also about proprioception too. So in our club here, they start, I think my daughter is just started it this year. She's 12. But I think depending on the kid, there is a modified FIFA 11 plus for younger kids just to get them used to the program. So I'd say 10 or 11.
Are you using pickup soccer subjects? Well, that's attached to the survey. It says, would love to contribute to your survey. Are you using pickup soccer subjects?
I'm focusing more on organized soccer. So it would have to be club, high school, college, or professional. And now if you're a female and you've played club soccer and had an injury during that time, then please, take the survey. So I don't know if that helps.
What youth boys cleats do you recommend?
So again,
Ida for boys and men as well. Sorry.
Yeah, I like Adidas and Puma for boys.
Okay.
My My biggest thing with boys and men's cleats are the stud length. I find that I think these injury risks are really elevated when people aren't educated on the length of the cleat and the playing surface.
While female period synchronization may be a myth, what is the correlation of pheromones with menstrual cycle and increased risk for injuries?
So the biggest things that have been found with the studies that are done are the increased estrogen levels and ligamentous laxity, because the knee complex isn't as protected as much when those ligaments are looser. Those are the studies that are out there, but again, there's not a lot, and that's why there's like 2 or 3 good studies that have been done, and some of them contradict each other. So there's not enough data out there to make solid recommendations. That's why we're trying to kind of get these surveys out, and if with my survey, there are a lot of questions about the menstrual cycle and what phase you're in when your injury occurred, whether you're taking birth control when the injury occurred, or even if you had any idea. A lot of players have no clue where they're at on their cycle when their injury occurred. So it's the more data we get, if I can get thousands of players to take this study, then we'll have a lot more information to go on to answer that type of question.
Are there any head-to-head studies between the different cleats and risk of injury?
No, not that I know of. I don't know if those big companies would like that.
Why are teams reluctant to use pulsed electromagnetic fields for injury prevention and bone healing when evidence clearly demonstrates efficacy?
I don't know the answer to that. I guess I need a little bit more content around that. What teams won't use it, and is there a certain product that is being pushed on the market for that? I'm not sure.
Yeah. I know your specialty is mainly soccer players. Do you have any recommendations for gymnasts?
So that's kind of taking shoes out of the mix, but it doesn't take the strength and conditioning, the rest, and the hormones out. So I think the risk factors are still there for those female athletes as well. Gymnastics is one of those sports that overuse injuries are pretty significant. So one of the biggest recommendations for gymnasts is time off, rest between meets, and then also proper strength and conditioning, and maybe consider hormone tracking for the women. I'm sure they do it on the high level teams as well.
Do you have any shin guard recommendations for youth and adults? Male
So
and
the shin
female?
guards are getting a lot smaller. Like my kids hate wearing them. They always pull their socks down and pretend like they don't have them on. But I don't have any brand names on top of my head, but there are ones that kind of just sit inside the sock that kind of mold more towards the shin that are more comfortable for players. So I think those lower profile shin guards are more popular now and gives them the players a little bit more flexibility.
Jay, this one is a good one for you, and it actually came up on our webinar last week about PowerStep being on Amazon, and we talked about how the ProTech line is specifically in for practitioners and not available on Amazon. Can you confirm that?
So obviously designed by a podiatrist for podiatrists. But yeah, I think the main difference is ProTech versus Pinnacle, which is our medical classification, which is ProTech. Highest quality material. It's going to last longer, going to provide better shock absorption. That is available on Amazon. We had to do that because we had some violators, some podiatrists actually out there putting it on Amazon, driving the price down, which was eroding the value of the brand. So we put it on there and it's at $75. And then, it's incumbent on us to be able to protect that value. So really what you want to look for is the ProTech. The ProTech is the best quality PowerStep product that we have.
This question, I think, is related to the electromagnetic whatever. It says pros and youth teams and everything in between use various forms of shockwave. So I guess the question is, do you have any experience with athletes using shockwave therapy or anything like that to prevent or treat injuries?
So for treatment, absolutely. For calcaneal apophysitis, I don't use it personally in my own practice because it's a cash-based service, and I'm hospital owned, so it's a little bit tough there. But there is a lot of good research out on decreasing inflammation for plantar fasciitis, Achilles tendonitis, calcaneal apophysitis, for all of those things that may occur during a sports injury. As far as prevention, I don't know, but I'm sure that there are studies out there for prevention. I'm not quite sure about that, but I definitely with treatment.
Yeah. Okay, and then Ben Pearl commented about his question earlier with the electromagnetic field pulsing. He said, I find professional teams to be slow to adopt anything that is suggested by sources outside the internal physician / athletic training team staff, for context to that question.
That's true. That's tough. Yeah, I mean, everything has to be approved. Even getting my survey out through US Soccer, I worked on this for a long time with their researcher, and it's a process, and it has to be approved by all the higher ups, and there's a lot of politics involved. So yes, as far as the treatment and medical care for athletes, it all has to be approved by their head physicians.
Yeah. Okay, so we have answered all of our questions. Like I said before, the recording of this will be on our website by the end of the week in the archive section. Dr. Richards, do you have any comments that you want to add in closing?
I just thank everyone for tuning in and listening. I'm very passionate about this, as you can probably tell, and I hope that we can continue to support our youth and female athlete population and mitigate the injury risk and provide education for the clubs and professional level teams. So all of you out there, as physicians working with athletes, it's important to educate all of them because you'd be surprised at what they don't know. And I was really surprised when I started lecturing at how much even the professional athletes don't know about some of this stuff. So keep up the good work.
Jay, where can we see Power Step or Curex or all of the things out in the real world?
This week at APMA down in Dallas. So
awesome.
There.
Okay. So thank you all for tuning in. Thanks PowerStep for sponsoring. Keep your eyes out for emails for our follow-up webinars. We have another one from PowerStep, I think, coming up in September. And next week on the 28th, we are taking a break, and then we'll be back with SureFit on August 4th. So thank you, everybody, for joining us. Thank you, Jay from PowerStep, and thank you, Carly. We appreciate it.
Thank you both. Appreciate it.
Good night.
Thank you. Night.